Hello and welcome to Chapter 2, The Well-Being of the EMT. We're going to take a look at well-being, personal protection, diseases of concern, emotion and stress, and scene safety. So let's take a look at the importance of well-being. It's important to keep yourself prepared for demands and risks of being an EMT, because if you're unable to function for any reason, your patients may not get the needed care. So how do we maintain well-being? Well, we maintain through solid relationships. Um, Having that personal support system is important to maintain and to have, whether it be family, other EMS colleagues, or friends. But they're always there to help you every day if needed, and to help you get through things. Exercise. Exercise is a great way to relieve stress, and to um, maintain your strength and flexibility as well. Um, Sleep, although we don't all get enough sleep that we need, it's important to have a good sleep schedule on your days off, and to maintain that sleep and get enough sleep. Eating right. EMS sometimes is not the most forgiving with eating right, but it can be done if you're committed to doing it. Limiting our alcohol and caffeine intake. I'll be the first one to tell you that caffeine is what keeps me going. Coffee is my mainstay, and I take a lot of caffeine in. So, and then seeing your physician regularly and keeping up to date on vaccines. Those are all things that help you maintain your own personal well-being. So now let's take a look at personal protection. Um, Standard precautions include steps of to protect ourselves from pathogens. Scene size up and protocols provide information on precautions to take. Standard precautions are those standard things that OSHA has deemed it necessary for different types of like bodily fluid or um, chemicals or anything like that we need to be um, aware of. So standard precautions typically include gloves. If you're gonna do anything with the airway, then goggles and a mask or a face shield of some kind. Okay. Um, so OSHA has issued strict guidelines about precautions against exposure to bloodborne pathogens. You'll also take, typically, you'll take a bloodborne pathogens class of some kind. It's an OSHA requirement. So, and then of course refer to your local protocols for wearing personal protective equipment. And when in doubt, wear it. My other phrase for you is, if it's wet and not yours, don't touch it. Okay. Pretty common sense stuff. All right. So always wear your personal protective equipment to prevent exposure to contagious diseases. So protective gloves, always have vinyl or other non-latex gloves readily available. Gloves should be changed in between patients. I always have at least one pair on me, and then I'll get another pair out of the box when I go on a call. So I've always got at least an extra pair on me. Okay. Hand cleaning. So hand washing is probably the best way. Alcohol-based cleaners, they're considered effective by the CDC. And alcohol-based hand sanitizers can be used if soap and water are not available. Of course, if your hands are soiled, then you definitely want to do a hand washing. Careful, methodical hand washing is effective in reducing exposure to contagious diseases. Wash for at least 20 seconds. Okay. Alcohol-based cleaners are effective when available, often when soap and water are not available. Sorry. So eye and face protection. Eye protection prevents splashing, splattering, or spraying fluids from entering the body. You should provide a guard. It should provide a guard from the front and the sides. Okay, so eye protection right here. Wear a NIOSH approved respirator when you suspect that a patient may have tuberculosis or any kind of droplet particle type respiratory problem. Okay, TB, COVID-19, all of those things. Masks. In cases where there will be blood, fluid splatter, wear a surgical type mask. In cases where TB is suspected or COVID-19, wear an N95 or high efficiency particle air respirator approved by NIOSH. So an N95 works pretty well. Those are what most services have. And you'll go through an N95 testing, mask testing, mask fitting. So that way you have the correct mask. Okay, so wear a protective mask and face shield when suctioning a patient. Gowns may also wear, you can also wear a gown to protect your clothing and bare skin from spilled or splashed fluids. All right, so let's take a look at diseases of concern. So hepatitis B and C, there's lots of strains of hepatitis B. These are infections, but specifically B and C, these are infections that can cause inflammation of the liver. They can live on surfaces in dried blood for several days. Hepatitis B is deadly, killed hundreds of healthcare workers each year before a vaccine was available. Hep C has no vaccine, but it poses the same risk. In our program, you're required to have the Hep B vaccine before you can go and do clinicals. So TB, it infects the lungs, it's highly contagious, and it's airborne. HIV, it attacks the immune system, leaving the patient unable to fight off infection. It's transmitted via blood or through sexual intercourse. So yeah. AIDS is a set of conditions that results when the immune system has been attacked by HIV. AIDS has a lower risk for healthcare workers than hepatitis or TB. Contact with blood, usually the route of infection. Ebola. People in the U.S. infected in 2014, hemorrhagic fever type deal, high rate of deaths and a lack of definitive treatment. Okay. Severe acute respiratory syndrome, spread through respiratory droplets, and Middle Eastern respiratory syndrome is found primarily on the Arabian Peninsula. Along with SARS, we're in the midst of, at the time of this lecture, we're in the midst of COVID-19. And of course, that's a worldwide pandemic. It's spread the same way through the respiratory droplets. So avian flu is found in poultry. It can affect humans, but not easily transmissible from human to human. Influenza has been around for hundreds of years. In the 1918 pandemic, killed about between 30 and 50 million people around the world. So let's talk about infection control and the law. EMS personnel, other healthcare workers are at high risk of coming into contact with infectious diseases. There's guidelines for workplace safety developed by OSHA and other federal, state, and local agencies. So occupational exposure. OSHA has a standard on bloodborne pathogens that requires infection control to be a joint responsibility of the employer and employee. EMS agencies provide training, protective equipment, and vaccinations to the employees, and employees participate in an infection exposure control plan. Okay. So that infectious exposure control plan, adequate education and training, the Hep B vaccination, PPE, methods of control, housekeeping, labeling, post-exposure evaluation and follow-up, all of these things go into that control plan and helping to minimize exposures. So the Ryan White Care Act, this allows EMS providers to find out if they've been exposed to potentially life-threatening diseases while providing patient care. A designated officer gathers facts about potential exposures. There's two notification systems. There's the airborne disease exposure and a bloodborne or other infectious disease exposure. Once notified of an exposure, the employer will refer you to a healthcare professional for evaluation and follow-up. So what happens is you take a patient in that you didn't know or didn't suspect that they had TB or hepatitis C or something like that, and you got exposed. Okay, so what happens is the hospital that you took them to will notify your EMS manager, and your EMS manager will then help you get the right care that is needed, set you up to get your evaluation and follow-up stuff. So TB compliance mandate. OSHA's respiratory standard includes the selection and use of respirators. N95s are good. So caring for or transporting a patient with suspected TB, we want to wear that N95 or HEPA mask. Caring for patients suspected of having that TB. We need to make sure that we have a fit test for that N95. Otherwise, that N95 is not going to do a dang bit of good. So wear the N95 mask when you transport an individual from such a setting in a closed vehicle. We also want to place a mask on the patient. It doesn't necessarily have to be an N95, but a surgical mask would be just fine. And also when performing high-risk procedures such as endotracheal suctioning and intubation. So immunizations for hepatitis B, other infectious diseases should be available through your EMS agency. Of course, through our program, you're required to have those before you can do clinicals and start your clinical time. So you have to go have that done, and then also a TB test done, and those are good for a year. So, all right. So now let's switch gears and talk about emotion and stress. So the physiological aspects of stress. Stress is inevitable in the EMS profession. Recognizing the signs of stress and developing strategies to deal with that stress are very important to your career. Okay, so there's these stages in stress that we all need to be aware of and recognize. So the first stage is the alarm reaction, or that fight or flight. It's not necessarily an immediate type deal. It can be, over a very long period. And then the second stage is the stage of resistance, or coping. The third stage is exhaustion, loss of the ability to resist or adapt to the stressor. Okay. So types of stress reactions, these may occur as the result of a critical incident. Any situation that triggers a strong emotional response. So acute stress reaction is often linked to a catastrophe, occurs in EMTs and patients. Signs and symptoms develop soon after an incident. There's physical, cognitive, emotional, and behavioral symptoms. Normal reactions to extraordinary situation, and may require professional intervention. With an acute stress reaction, typically your job, your employer, your agency should have some type of critical incident stress team that helps you through these. But just know that whatever the situation, whatever you're feeling, however you're feeling, they're normal reactions to that extraordinary situation. And you need to be aware of that. Okay. So a delayed stress reaction is also called PTSD. Signs and symptoms are not evident until long after the incident. The delay makes dealing with reaction much harder, and the patient may not recognize what is causing the problem. It requires intervention by a mental health professional. Okay. It does happen. It can happen. I'm not saying that it will happen to everybody, but it can and does happen. Okay, so cumulative stress reaction. This is what I also like to call moral injury. So this results from years of sustained low-level stressors or high-level stressors, because in our job we see those high-level stressors like pediatric deaths. We see deaths, sudden deaths, like a 36-year-old who just suddenly died because of a car accident or something like that. We see those things on a high frequency basis, and we have this cumulative stress reaction or moral injury, and we have to be able to be aware of that and know what is happening. Okay. So early signs are vague anxiety, emotional exhaustion. They can progress to boredom and apathy and a feeling of emotional exhaustion. And then if the signs are not recognized now, what you'll see is, I don't like the word, but you'll see burnout. Okay. You'll see your providers who've been in the service for 20 plus years start to have burnout or a higher degree of moral injury, and they'll start to be apathetic to the job. They won't necessarily want to come to work. They may drink all the time, those type of things. So recognizing this now at the beginning of your career and knowing how to limit those stressors and how to deal with stress and handle that stress will allow you to um, maintain your job longer. So again, it progresses to physical complaints, loss of emotional control, irritability, depression. It may present as severe withdrawal or suicidal thoughts requiring long-term psychological intervention. All right, so let's talk about some of those causes of stress. So multiple casualty incidents, or MCIs. Um, the When we get into like chapter 37, 38, I think, we'll talk about multiple casualty incidents and the decisions that have to be made with those MCIs, and how they can affect us. Calls involving infants or children, those are always bad. I'm not a fan of having to run on a kid. I have 4 of them myself, so it sucks to have to run on a kid. Severe injuries, abuse and neglect, and death of a coworker. So signs and symptoms of stress. There's eustress, which is a positive form of stress that helps people work under pressure and respond effectively. There's distress, which is a negative stress causing immediate and long-term problems with health and well-being. Irritability, the inability to concentrate, changes in daily activities, anxiety, indecisiveness, guilt, isolation, loss of interest in work. All of those things are signs and symptoms of stress. So let's think about this. If your partner is beginning to show signs of stress, what should you do? Well, bring it up to them. Say I've noticed you've been stressed a lot recently. Do you want to talk about it? They don't want to talk about it, just be there for them. Offer to go get a cup of coffee after the shift. Go get a drink after the shift. Well, I wouldn't suggest a drink, but cup of coffee, a meal, something like that. What possible risk could there be to you and your partner if a patient if stress is left unresolved? Your partner or you could, if you're the one that is having the stressor, then anything like scene safety, you could be apathetic to. Your situational awareness may be diminished. Your care for the patient may be diminished. So all of those things may be diminished and not helpful. Okay. So do you have an obligation to act to help your partner? Yes, you absolutely do. If I was in that same situation, I would want somebody to act and help me and say, hey, I think you need a break. What can we do to help you? Type deal. And actually care and get in there and say, hey, something's going on. Okay, so dealing with stress, lifestyle changes. You want to develop more healthful and positive dietary habits. Exercise, devote more time to relaxing. Change shifts or location for a lighter call volume, or different call types, and maybe have some more family time. Critical incident stress management is a comprehensive system. It includes education, resources to prevent stress, ways to deal with stress appropriately when it occurs. We also have what is called a critical incident stress debriefing. It's designed to help responders diffuse after an incident. It's a team of trained peer counselors and mental health professionals that meet with the rescuers and healthcare providers involved in the major incident 24 to 72 hours after that incident. And it helps responders deal with stress. So, understanding reactions to death and dying. Do not usually see dead people except at a funeral home. Do not normally see people die. Often the most difficult part of the job, and dealing with family may be more difficult. I know for me, dealing with death and dying, I have it is an emotional toll that it takes. I'm almost emotionally exhausted after I work a code. And it's not necessarily working the code that makes me exhausted. It's talking to the family, telling the family that their loved one has died and that, we've done everything that we can to try and bring them back, but there's just not anything that we can do. So that's the emotionally exhausting part of it. And you have to recognize all of these things and recognize that, what you're feeling is normal. Okay. So, there's emotional stages that go into death and dying, and you can go through these just as well as the patient's family can go through these. So there's the denial, anger, bargaining, depression, and acceptance. These are just the 5 stages. Not everybody goes through all 5 stages, and not everybody goes through them in order. So it just kind of depends on the patient and their relationship to the person that has died, and various things like that. So we want to recognize the patient's needs, be tolerant of angry reactions from the patient or family members, listen empathetically, do not falsely reassure, and offer as much comfort as you realistically can. Scene safety. So EMS is usually not a dangerous profession. Being aware of potential dangers is always a priority. Determining scene safety will be the most important decision on any call. Hazmat incidents. The primary rule is to maintain a safe distance from the source of the hazardous material. Placards. Ensure that your emergency vehicle is equipped with binoculars. They correspond with coded colors and identification numbers that are listed in the ERG, or the Emergency Response Guidebook. So roles, we want to recognize potential problems, take actions for personal safety and the safety of others. Notify a trained hazmat response team. Do not treat patients until after they've undergone decontamination. We don't necessarily get into the ins and outs of hazmat incidents unless we're part of a hazmat team. But it is need to know information. Terrorist incidents may be small or large in scale. May include agents, chemical agents, biochemical agents, radiation, and or explosive devices. So rescuing or disentangling victims from fires, auto collisions, explosions, electrocutions, and more go into rescue operations. We want to evaluate each situation and ensure that appropriate assistance is requested early on in the call. Never perform acts that you are not properly trained to do. We also for us, we don't necessarily do any of that unless we're part of that specialized team and we're working in that capacity. There are Um, there are various other things that go into rescue operations, and you've got to have those things in order for it to help the patient in the long run. So violence, plan, wear safety clothing, prepare your equipment so it's not cumbersome, carry a portable radio whenever possible, and decide on safety roles. Okay. As a precaution, do not stand directly in front of a door when knocking or ringing the bell. So observe, survey the scene on approach. Do not announce your arrival. Turn off lights and sirens when you start to get towards the house. Drive a few feet past the residence so you can see front and sides. So we want to observe violence, crime scenes, alcohol or drug use, weapons, family members, bystanders, perpetrators, pets, any of those things, okay? So how do we react to danger? The 3 R's: retreat, radio, and reevaluate. So retreat, just like it says. We're going to get out of there as quickly and as safely as possible. We're going to radio to dispatch and tell them, hey, we need PD, we need assistance, something. And then we're going to reevaluate and not enter that scene until it's been secured by PD. So never enter a scene that's potentially violent until the police have secured it and told you that it is safe. React to danger. Flee. Get out. Get rid of any cumbersome equipment. Take cover and conceal yourself. That cumbersome equipment can be used to slow down your attacker or whoever's chasing you, if there's anybody chasing you. So, it's replaceable. You're not. Okay. Cover and concealment. All right, so let's take a quick review of the chapter. Your well-being is an important concept. This chapter has provided several ways to protect and maintain it. In your book, it goes into a little bit more in-depth explanations of various things that you can do to maintain your well-being. So make sure that you read the chapter. You should never take safety or standard precautions lightly. Each is an important decision you will make at least once at each scene you respond to, always. Protect yourself from violence and scene hazards at all costs. Protect yourself from disease. Do not be paranoid about catching a disease, but take appropriate precautions. Stress may be an immediate reaction from a particular call or cumulative, that moral injury that we were talking about. From a combination of life and EMS. Both are bad for you, and seek help if you need to. So you will see death and the reaction to death. Each is very personal to those involved. The stages of death are denial, anger, bargaining, depression, and acceptance. Treat people who are under stress fairly and compassionately, even if it is difficult to do so. Scenes are dynamic and can change in an instant. Assessment of scene safety is an ongoing process. Don't be so focused on the patient that you lose perception of what is happening around you. So questions to consider. Again, I'm not going to go into these. I'm just going to read them. And I want you to think about them as we've talked today and we've gone through the chapter and you're reading your book and all that. Okay, so what precautions must I take if I'm dealing with a patient who has an open wound? What can I do to help with stress? A patient who refuses to believe she has a terminal disease is in what stage of dealing with it? All right, so let's do some critical thinking. You were called to an unknown emergency at a tavern. As you approach the scene, you see a man lying supine in the parking lot, apparently bleeding profusely. 2 other men are scuffling, and one seems to have a gun. What actions must you take? Okay, so obviously the scene is not secure, so we're going to wait until PD secures that scene, unfortunately. I know it takes a lot to, especially when we see somebody bleeding out or, hurt, our initial inclination is to go and help them. But if the scene is not safe, then you can't go and do that. Because, again, if something happens to you, then you're not there to take care of that patient. So you've got to be able to take care of that patient and make sure that the scene is safe for you. Again, this has been chapter 2 of the well-being for the EMT. So if you have any questions, comments, anything, you can text, call, or email me, and I will try and answer those.